So, Dr. Arun Sharma.
Right.
Dr. Arun is an outstanding Ayurvedic physician who expertly connects traditional Ayurvedic knowledge with contemporary medical issues. Dr. Sharma, dedicated to preserving and modernizing Ayurveda, the ancient Indian healing tradition, is a respected educator, and his courses and seminars encourage introspection and a more holistic view of health and wellness. Yeah, I'm right. Arun, can you tell me what is one unique or unexpected fact about yourself that your patients might be surprised to learn?
About myself?
Yes.
Means I don't know what patients will be surprised from, but I can tell you what I get surprised of. So when I basically started practicing Ayurvedic medicine, then I always saw that, or that was told to me by everybody, that Ayurveda is an alternative medical system. But more I am practicing it, I have realized actually it is a first line of treatment. It's not an alternative medicine.
I see, yeah.
Yeah. So I started practicing it in my clinic as a first line of treatment. You know, so that was very surprising for me always, because what people think about it, or what I was thinking about it, was actually not right. You know, so now I practice Ayurveda as a first line treatment, and I think many people should know about that. It might be surprising or not surprising, but that's the fact.
That's the fact, yeah, you're right. What is the most impactful piece of wisdom you have received from a mentor or teacher?
Many different ones, I will say. One of my most important mentor was my own grandfather.
Oh, really?
Yeah, so he was an Ayurvedic medicine physician too. And he always told me to understand the life in its holistic form, and to see the reality all the time. You know, for example, you are sitting here right now. I am sitting here, and am I real?
Yes.
It looks like I'm real, but in reality I am actually temporary, and you're also temporary. We all are temporary, isn't it?
I get it, yeah.
So when we all are temporary, and we start getting this perception that we are real, then we get attached to each other, we get attached to ourselves, and that actually causes suffering. You know? So this is one of the most important wisdom that I have received, that it's good to see the things as they are.
And especially from your family.
Yeah, from my grandfather, I will say.
That's
so
nice. Oh, really?
Yeah.
Oh, really? And how did your journey into Ayurveda begin, and what were some key influences?
Yeah, so first influence was from the family. Like my father is a Sanskrit language teacher, and so Ayurveda is written in Sanskrit language. It's an ancient language of India, and plus my grandfather was also a physician, and plus I got sick myself in childhood, and I could not find any other solution other than Ayurveda. So I think these all were the moments that helped me to realize that this is the path for me. Yeah, so then I started taking interest, and I started studying with my grandfather first, and also Sanskrit language from my father. And then when the time arrived, then I took admission into medical college to study Ayurveda professionally. Yeah.
That's nice.
Yeah, so it's a simple journey.
Yeah, but it's, you know, when it came from family, I think it's the best gift what you can get.
Yeah, I think especially my grandfather was very happy, because he wanted to preserve this knowledge, and he had a lot of experience, so he wanted to, I think, give it to somebody who can carry it forward. You know, so I think more than me, it was maybe satisfaction for him too. So, yeah, of course, now I feel honored. Yeah.
Okay, thank you. What challenges have you faced integrating traditional Ayurvedic knowledge with contemporary medical practices?
Actually, I don't see it as a challenge, you know, because I don't see the medical systems very different from each other, you know. Basically, there is one human body. We all are trying to understand it. You know? There is a Western medicine lens.
That's true.
There is Ayurvedic lens. There is homeopathic. There is many other healing
others,
traditions.
yes.
You know, but for all of us, the subject is actually one. You know, we all are studying the human body. So languages are different, but ultimately, if you see, the meanings are very similar. Yeah, where is the difference? The difference is actually in the approach, and that's where the challenge comes. Because many people, when they compare chemical medicine or Western medicine with Ayurveda, then they see that in Western medicine they get very quick results. You know?
Can you combine it like practical medicine and Ayurveda? Can you combine it?
Yeah, you can combine it. In India, we combine it. Like, you know, in India, we actually practice both together also. You know? And there are many patients, those who are going to a Western medicine doctor for certain things and also at the same time going to Ayurvedic doctor. Like, for example, I have many patients like that too, those who do that. And if you use it properly, then of course it can be very beneficial for the patient. If of course you are using it without any guidance, then there can be problems too. You know? So the main challenge sometimes is to explain the patient that Ayurveda is not only like a pill or a medicine that we can give you. It is a whole lifestyle change that you have to do in order to perform healing. Yeah.
Thank you. That's perfect. And can you share a story about a turning point that significantly changed the direction of your career? Was it some point in your life you was like, okay, I have to change it?
Yeah, so like unfortunately or fortunately I will say that that I have only been in one career, you know. So I've never of course changed my career, but of course there are many turning points within my career, that you're right. For example, one story I'll give you. Initially, I was a very rational person. I'm also Western educated, and I always kept rationalism above anything else, you know, that many people do. And once I got a patient who was suffering from a very chronic skin disease. And with him, I saw the power of mind. Before that, I never experienced it. Like, I had heard about it, but I never experienced it, that it can happen. So he came to me and he told me that he have some chronic skin issue and he want to get treatment for that. I tried to treat it, but he did not have much patience. After 7 days, he said that it's not getting better. So I, of course, tried to explain him that this is a chronic issue. It might take some time. In 7 days, it's not working. But in the meantime, he said that he have heard that there is a temple at some distance, and there is a small lake. If he will take bath in that lake, somebody told him, then his skin disease will become better. It's a blessed water. So, of course, I did not believe him at all. And but he went. He did not listen to me. He went there, and after around 2 weeks, and he came back to me, and he said that his and he showed me that his skin is completely clear.
Oh,
and,
really?
yeah. And I thought that how is it possible? So I thought I should investigate, and I should try to find out about this lake. Maybe there is some medicinal properties in the water,
Something inside.
Yeah, or some herbs are there or something. So I went there personally to check it out. But you will not believe me, that was one of the most dirtiest pond I have ever seen in my life. There were thousands of people taking a bath in that small pond, and even leaving their old clothes there, and it was like a muddy water. And the people are taking bath there, and after that they come out and they're saying that they're a bit better. So then I realized actually it's the power of their mind. So sometimes where medicine doesn't work, where herb doesn't work, this power of mind, this potential of mind can also be used for healing. And you must have seen sometimes many patients, when they trust something, when they believe something, that medicine works easily. We call it placebo.
Placebo.
But actually it is their mind that is doing that. So we can call it placebo, but then I realized that also can be used. So sometimes if a patient has a belief, a strong belief in something, and of course by taking the safety things in mind, that belief can actually be used for healing. Instead of discouraging him blindly or not listening to the patient, with that you also break the connection with the patient, because when you don't listen to the patient, then the patient will think that you are not taking him seriously, and then of course the resistance starts. So this is one very important turning point I see in my career.
I agree for 100%. The mind, the power of the mind is mindful. It's so amazing. I agree, totally agree. Thank you. How do you find harmony between different healing traditions in your work?
I actually always believe in integrative approach. So I always say that Ayurveda actually is an umbrella science. Under Ayurvedic umbrella, everything can work. For example, Western medicine is a very, you could say, a micro picture of everything. If you look at Ayurveda, Ayurveda is a holistic picture of everything. So in order to heal, you need both the pictures.
Both of them.
It's good to have a micro picture. It's good to have a very holistic macro picture. And even other healing traditions like yoga or homeopathy is there, or some other healing traditions are there. Once we understand both the pictures, we can actually use all of them in harmony. So that's how I have basically worked in my practice. I don't refrain from using any other healing traditions too, if they are useful for the patient.
Yeah, if they are useful.
Yeah.
Right. Can you describe an instance where a workshop or retreat had an unexpected outcome that taught you something valuable?
Oh, I think I'm in a healing festival right now, so here already many things I'm learning valuable, and for example, today I was talking in the morning, and I was talking about Ayurvedic nutrition. And sometimes as healers or as physicians, for us nutrition or any healing practice is a day-to-day job. So we also expect that it's very common for other people also to know things. So this I try to learn again and again, and even today was a repetition of that. That I was talking about nutrition, and then somebody was asking me a very simple question. And in my mind, initially it was a very simple question, but then I actually realized that maybe for me it's simple, but for many people it's not their day-to-day job. So things might not be very simple for them. So what I learn almost in every talk or workshop is that it's very important to listen to your patient.
Listen and think.
It's like being a healer. I think it's very important to have a good feedback from your patient.
Exactly.
So then you can help them better. And for that, of course, you have to go into their boots. Rather than being in your own idea that, okay, you know things, but there are many people those who don't know, and actually it's our duty to teach them properly and to take their feedback seriously.
Be a good listener. That's
very
very
important.
important. Okay. What is your approach to creating a safe and transformative space for your patients during treatments and seminars?
Yeah, so I will take a quote from one Ayurvedic book called as Charak Samhita. So father of Ayurvedic medicine is called as Charak, and
Charak.
he has written a book called as Charak Samhita. So he basically have told that every practitioner or every physician, whenever he is trying to treat a patient, then he should see the world from the patient's point of view. You know, or see everything from the patient's point of view. I will just repeat myself that it's better to go into his boots or her boots, you know, and then see the world. Because for as a healer, it's very easy for us to tell somebody that maybe you just need to relax, or maybe you just need to follow this diet. But sometimes patients have certain difficulties. They're not able to do things which might look very simple for us. So it's very, very important that we have to enter into their boots, and then we have to observe the things that actually helps us to create a free space for them, because they feel safe in that environment. They also feel that the physician or the healer is listening to them and understands them well. And once we have that kind of trust with the patient, then of course they are ready to do or even ready to make any changes that are required for their treatment. You know, so I think it's very important that rather than imposing your point of view on them, it's very important to listen to them and to see the whole scenario from their point of view.
That's true. Make the safe place.
That's what the safe place is. Yeah.
Exactly. How did your first experience at the Healing Festival define your expectation?
Define my expectation?
Yeah, expectations.
I generally don't go
If you
anywhere
have
with
any.
expectations, you know. So it's better to start without expectations. But in one word, if I will say what is my experience in Healing Festival, it is fantastic.
Fantastic.
It is like
my
absolutely
God.
fantastic. I think it's organized very well. It is a very safe space for people, those who want to learn new things. And thank you for even for the for us also, for healers also. I think your organization is absolutely fantastic. You know, so yeah. What more I can
Appreciate
say?
it.
Yeah.
Thank you.
Yeah.
And can you share a transformative moment you witnessed or experienced at the festival? You already said, but if you have another one, some?
Yeah, there are many. I'm actually meeting many people here in the festival, and many people from other healing traditions too. You know, I met even a lady who is doing some ceremonies, and she said the ceremonies have roots in Africa. You know?
Africa.
And so it's really, I think this place is such a connecting place. It is joining the whole world together.
And big inspiration.
Yeah, big inspiration, and people from different parts of the world, people with different knowledges. I think they're coming together, and I think this is inspiring for everybody. You know, so I of course learned many things. I even joined some other workshops and some other things. So it's a very nice experience for me. And plus, I met many patients, those who I feel they really need Ayurvedic medicine. You know, so yeah, it's absolutely fantastic.
So you love it.
Yeah, I love it.
You
Yeah,
love it.
yeah.
Okay.
Yeah.
What unique elements are you bringing to this year's festival that attendants shouldn't miss?
Yeah, so basically what I'm bringing with me is Ayurvedic medicine, you know, Ayurveda. And I've done around 5 workshops. Actually, I have already done 3. I have 2 more. And I will be discussing about an Ayurvedic way of detoxifying this human body and mind. And that workshop I think is very, very important, and I will advise everybody that
That's in my program.
Yeah, so
Your
if they
workshop?
want to detoxify their system through simple techniques at home, also even through fasting, like how to do it properly, I think that will be very, very important. Yeah.
I can wait for it.
Most welcome.
Yeah, thank you. What are your long-term goals for your Ayurvedic practice and teachings, and how do you plan to achieve them?
Again, I don't plan
Very
much.
question.
Yeah, but I have. I always had this goal in my life that at some point I want to train other Ayurvedic doctors also, and a proper education can be designed somehow. So right now we have an Ayurvedic hospital. At some point we want to have an Ayurvedic medical college where we can train
really?
other physicians.
That's nice.
And that's of course
Maybe
a
I'm gonna
lifetime
be
goal.
the first one.
Most welcome. And I think the hospital, one person cannot, of course, provide treatment to many. We just need more people. So we have many courses, even for those who don't want to become doctors, because to become a doctor you need almost 5 to 10 years.
Yeah.
But we need also many people with a basic training of Ayurveda, those who can act as therapists, they can act as health coaches, like many yoga teachers, many physiotherapists, or people from other healing traditions too, those who can guide people in their day-to-day health problems. There are also many manual therapies like oil massages, Shirodhara. I mean, these treatments are there. For that, you don't have to become a doctor. You know, that can be given even by being a therapist.
Yeah.
So that we are already doing, I think, and we also have an online course now. So, people, those who can't travel to India, they can actually study that online.
Yeah, that's perfect. That's perfect. Yeah.
So that's, and the long-term goal of hospital I already told you. Yeah. Yeah.
So then, how do you hope to inspire and support your upcoming Ayurvedic practitioners through your work? There's like a connecting.
Yeah, I mean, we already have a small community. Like so, I already have some students or therapists, those who have learnt with me. Some of them were actually performing in the festival also.
Oh.
Yeah,
That's
and already in Czech I have around 2-3 people, those who practice Ayurveda, and so I keep supporting them continuously. We are in touch, through Zoom and online. We have
That's
an online
perfect.
community,
Yeah.
and I like to support my students in that. So even nowadays, even patients, those who are not able to come to India, we provide them online consultations too. You know, so I think the technology have opened up the gateways. We can actually be in touch with people all over the world and support them in whatever they need. Yeah.
And another question is, how can our audience stay connected with you online to learn more about your work and future events?
For future events, if people want, they can simply visit our website. It's www.ayurveda.com.
Perfect.
And maybe you can put a link somewhere.
Yes.
And so anybody who wants to take an online course, they simply have to go onto the website. They can simply email us, and we will send them all the information.
Perfect.
Yeah, it's very easy now. Like
easy.
I think technology have opened up many ways. Yeah.
Okay, so I would like to thank you for your time,
thank
your
you, Lucy.
presence.
Thank you, Lucy.
And I hope you enjoyed this festival, and I can wait for your workshop.
Most welcome. No, I will say that I really enjoyed the festival, and I can see everybody is actually enjoying it.
Yeah.
It's a very nice atmosphere here.
The energy here is like, I couldn't even sleep. I was like, oh my God, I don't want to sleep. I just want to be there. And the energy is so strong. Even you don't have to be anywhere and go to any workshop, but you feel it. You feel it inside. You feel the energy around you. It's everywhere, just everywhere.
Yeah, and I think because all the people here are gathered with the same goal. You know,
That's
so when all of us we are gathered with the same goal, then actually it does create a healing space and energy. Yeah.
Yeah.
So thank you very much.
Thank you.
Welcome.